Well, we are now 4 days away from the opening of the health insurance exchanges where you can buy a health care plan. In our continuing Understanding Obamacare coverage tonight, 5 on Your Side consumer advocate Jonathan Walsh is here with more insight into exactly what these exchanges are. And Jonathan, some states have actually set up their own exchanges.
Some have, but Ohio is not one of them. Here's the deal. Ohio opted out and is allowing the federal government to handle people right here in the Buckeye State. So here's the situation. The exchanges are places for people to compare and buy insurance plans, and you definitely have options for doing just that. This week we followed Bethina Glenn, Desiree Maxwell, and Claire Roche, who are all in the same boat looking for answers about buying health insurance through the exchanges.
Some more information would be great, I think, for anybody. So just, knowledge is key.
Starting October 1st, you'll be able to access the exchanges over the telephone, toll-free. There are physical locations as well, right here in Cleveland, including these organizations: Care Alliance Health Center, Carmela Rose Health Foundation, Asian Services in Action, and others. Plus, Newsnet5.com will have a link where you can go online for the exchanges.
They're going to give you a display of the available insurance product that are being offered on the market. It's kind of like the Travelocity for health insurance. So you'll see the product, you'll see the price. It will also determine whether you're eligible for any type of subsidies.
Professor Majette says you'll also be able to figure out if you're eligible for Medicaid or the Children's Health Insurance Program based on your financial status. If you are eligible to buy insurance through the exchanges, you'll see various levels of plans: bronze, silver, gold, and platinum, where you can compare just how much the premiums will cost you and how much out-of-pocket expenses would be as you visit a doctor or get your medicine. The Director of Strategy for Medical Mutual of Ohio says the system is designed to make sure you get the information you need.
They're going to make it as available as they possibly can. Again, what's the goal? Maximize enrollment.
If you do need additional help or want to talk to someone prior to looking at your options through the exchanges, the government has trained and certified people to guide you along the way. They'll be ready to answer your questions, and they're out and about in the community to help.
The navigators, their goal is to provide consumer assistance, to go out and actually find people and let them know that they're eligible, to also educate people just about the process itself.
Some of that assistance can be found at the very same places where you can access the exchanges. It's all help that these women say they appreciate because they feel they're in the same boat as well when it comes to available facts on Obamacare.
I don't think it was very well explained to the general population.
All right, so the toll-free numbers to access the exchanges are now at the bottom of your screen, and much more information can be found at Newsnet5.com. And folks, please remember, very important, if you want your insurance to kick in by January 1st, you have to sign up between October 1st and December 15th, but the deadline to sign up for overall insurance is March 31st. All important dates, and we can't stress it enough. We have a lot more information on Newsnet 5. Next week, when the exchanges open up, we'll have more coverage then.
It'll be interesting to see what happens then.
Yeah, absolutely.
All right. Jonathan, thank you.